being exposed to drugs, there's a term that we use, which is drug endangered. So we may have a drug endangered community, we may have drug endangered child, and so forth. So I want us to quickly look at what we mean when we say a drug endangered, whether it's a child or a community. This is a person or groups of persons. If they're a child, they will be under the age of 18, or young adults who live in or around or are exposed to an environment. So either you live in or are exposed to an environment where drugs, including pharmaceuticals, and in my preamble, I talked to why we also look at pharmaceuticals, drugs that are ordinarily used for medicinal purposes and medical reasons. Why do we include them in the list of the drug issues? We look at our pharmaceuticals, where we now have an environment where these drugs, including pharmaceuticals, are illegally used, illegally possessed, illegally trafficked, illegally diverted. And for diversion, we even mean at a household level, where you take medication that is meant for your own, ailments. You give it to somebody else to take, or you use it for something else, even yourself, other than that which it was intended. That's diverted and or manufactured. And as a result of that environment, the person or a child or a group of persons experiences or are at risk of experiencing physical, sexual, or emotional abuse. And these experiences are experienced by this child or group of persons. And worse, you also become at risk of experiencing medical, educational, emotional, or physical harm, including harm that results from possibly neglect, that forced participation in illegal activities, sexual activities, whether in exchange for drugs or as an exchange for money likely to be used to purchase drugs. So that's a bit of a comprehensive definition, but it captures a number of critical issues that you have to do with how we would conceptualize a drug-endangered child, a drug-endangered person, and a drug-endangered community, which we need to be aware of, so that when we even look at ourselves, we look at our families, we look at our communities, are we drug-endangered or are we not drug-endangered? And what kind of a mechanism can be put in place to address some of those issues. So in terms of what has been happening in Zimbabwe, there's been, for us to actually understand the problem of drugs, there has to be evidence. And that evidence, when it comes to Zimbabwe, is lacking. We do not have a single comprehensive national study on drugs. Now, you'll be worried, why then do we talk about so many statistics around when you are saying we don't have a comprehensive study on drugs? What I'm referring to is the fact that we have had isolated challenges with efforts that have gone towards researching issues around drugs, that we cannot nationalize any of the studies that are currently available because of the limited scope and methodological issues, where you have people doing studies on selected schools that are not really representative of the general population, which makes it difficult to take a situation in one area and extrapolate it to the whole of Zimbabwe to say, okay, this is really the drug problem in Zimbabwe and these are the critical issues that are there. We don't have such a comprehensive study. Those that are there have been very isolated and do not provide national representation. So this distorts the current picture of what is exactly happening with the drugs, because we actually don't have evidence that is empirical that gives us the proper picture. And in a way, that then curtails the ability of government and associated stakeholders to really intervene to deal with the issue of drugs, because we are not really aware as a country comprehensively what exactly is happening with the issue of drugs. So for policy, that makes things difficult to actually come up with a comprehensive intervention framework. And the Ministry of Public Service, Labour and Social Welfare has established a drug unit. They've actually established, it's a new one, less than 5 years old. So when you're looking at policy, that's very new, where we have a new drug unit, and that is meant or has become as a response to the declaration by the president of the drug pandemic in Zimbabwe. And so they are now beginning to see coordinated efforts that have come to addressing the issue of drugs. But then there becomes the challenge with how do you then intervene when you are really not sure as a country what is really our situation, how many really of our youths are really involved in drug abuse, where are these drugs coming from, who is pushing them through, and what is driving our communities to actually subscribe and embrace drug abuse. Or is our community really embracing it, or we are not sure? So when you have such a situation, it's now difficult to really tailor-make policy interventions that you become then effective in terms of addressing the issue of drugs.